So a lot of people have questions about, hey, what's this HMO thing? What's this PPO thing? So we're going to break it down. This is going to be a pretty quick video because it's a pretty easy breakdown. But what happens is with an HMO, it's a health maintenance organization. So don't ask me what that means or why they called it that, but here's how it works, okay? With an HMO, you're going to be confined to a certain network. Now, a lot of people see that as a really negative thing, but it can really work in your benefit if you, say, go to one hospital organization or you go to a few doctors that are in that network. You are going to have a smaller network, but with that comes greater benefits. So a lot of times with an HMO plan, you're going to have lower copays, you're going to have a lower maximum out of pocket, and you're going to see greater benefits on the Medicare Advantage side, such as more dental, more vision, more hearing, maybe more over the counter, or maybe even it gives you money back on your Part B premium. So if you are okay with an HMO, meaning you have to go to those set doctors, there's no out-of-network coverage, which can be a concern for people that say go to multiple hospitals or have doctors all over the country or just traveling in general. Maybe an HMO doesn't make a lot of sense because you don't have that coverage outside of your local area or your hospitals. One thing to know with HMOs though is that if it is an emergency, you have worldwide coverage. So if you're going to the emergency room, you're having a heart attack, you need a heart transplant, you actually have worldwide coverage with an HMO, and a lot of people don't know that. So if you, say, go on one trip to Arizona or one trip to Washington or Florida or whatever it is per year, and you're just worried, hey, what happens if something bad happens in those states, is actually you are protected at in-network rates on an HMO plan, and a lot of people don't know that. So there can be a lot of benefits to HMO, but if you're all over the place all the time, it could also not make sense at the same time. But just to recap, HMO, smaller network, I should say. It's not necessarily like if you go with a big carrier, those networks can be really large, but it's going to have a smaller network with no out-of-network coverage unless it's an emergency, but you get lower maximum out of pockets, lower copays, and more benefits usually. Not always, but that is usually how it works. Now let's talk about PPO. A lot of people prefer a PPO for one reason, and that's because they can go out-of-network and get coverage. This doesn't mean that some PPOs, they can cover you out-of-network at the same rates as in-network, or some PPOs have a higher cost out-of-network, but at the end of the day, you do have coverage. So it's a catch-22. On the HMO side, you have a defined network. You can't go out-of-network unless it's an emergency, but you get greater benefits. On the PPO side, you have the network flexibility, but your copays could be higher, your maximum out-of-pockets could be higher, and your benefits could not be as strong. So it's kind of something you want to weigh. Again, if you're what I would call a homebody, kind of like myself, you might benefit from an HMO because you only stay in one place and you're only ever going to stay in that one place, or maybe you're someone who travels and goes across the country, or just wants the flexibility. Like I'm in Springfield, Missouri. Maybe you have to go to the doctor or maybe see a specialist in Kansas City or St. Louis, or go down to Fayetteville, Arkansas. You're probably going to want a PPO if that is the case for you. So it's a pro and a con of both. There's not one that is better over another. A lot of people do prefer the PPO, and that's exactly how they work.